Okay, so today I'm going to talk about why FUT is actually still a really good option, especially for higher Norwoods. So there's a lot of misconceptions about FUT. A lot of people say that it's barbaric, that it's outdated, that's really painful, and that it's going to leave a really bad scar. And the truth is, FUT is not barbaric or outdated. It's a perfectly good technique. It works very well in the right hands, of course. So yes, we do have the option, of course, of doing FUE, which is definitely less painful, which is definitely less invasive. But there are a few very key advantages to using FUT. And the main one is going to be for higher Norwoods, that it allows you to get a lot more grafts if you do both FUT and FUE versus if you only do one. So is FUT painful? Yes, it's more painful than FUE. There's no arguing that, but it's certainly not an extreme amount of pain. It's certainly not something that you can't get through. Remember, for decades, people were doing FUT with a lot of success. If you look at Hassan and Wong in the 2000s and 2010s, doing a lot of FUT surgeries with high graft counts and getting amazing results. Until FUE got to the point where it is now, where we have very high survival rates, FUT was actually quite literally the gold standard, and it did work very well. And so, like I said, the pain is not that bad. You're going to be given some medication to lower that pain. And about a week after you get the surgery, it should be pretty much back to normal in terms of the pain. Of course, it's still going to have to heal and you're going to have to get the stitches removed, but the pain is not extreme. You can certainly get through it. As far as the scarring goes, when it's done in the right hands, FUT is not going to leave some horrific scar. Yes, the scar can stretch, but in most cases, even if it stretches, it's not going to be to an extreme degree. And those scars are going to be 2 to 3 millimeters wide and very easy to cover with a 3-guard. And even if you get a scar that you're not completely happy with, you have the option of using SMP or actually transplanting grafts into the FUT scar, which will lessen the appearance a lot. So even in the worst case scenario, which is pretty rare that you'd actually get a really bad scar, assuming you went to a good doctor, there's a lot you can do to reduce the appearance of that scar. So in the past, when FUE first came along, the survival rates were a lot lower compared to FUT. But now we're at the point where technology has gotten a lot better. The skill of surgeons has gotten a lot better. So the survival rate of FUE is very high, and it's around the same as survival rates of FUT, of course, as always, when done under the right hands. Another big advantage of FUE that you don't really get with FUT is that FUE allows a surgeon to cherry pick the grafts that they want to use. So if they want to use fine single hair grafts for the hairline, they can go and cherry pick those grafts, sometimes even from the nape region. With FUT, you don't really get to choose which grafts you're going to extract. You're just going to be forced to take the grafts within that strip area, and that's what you get. So a lot of times you'll see the hair per graft count in FUT surgeries be a little bit lower than FUE, but it's usually not that dramatic. It's usually closer to 2 hairs per graft with FUT and typically around 2.5 hairs per graft with FUE. But of course, as always, that's going to depend on your donor, on your own personal hairs per graft, on your own personal donor density, which does vary a lot from patient to patient. Another obvious issue with FUT is it's really not that common for surgeons to even do it anymore. So it is a little bit harder to actually find somebody who's doing it consistently and who's really good at it. The vast majority of clinics today are doing exclusively FUE, but there's still some major advantages to using FUT. And the biggest one is if you're a higher Norwood, you're going to need a lot of grafts to get full coverage and good density. Okay. So if you're a Norwood 6, typically you will need close to 10,000 grafts to get good coverage and good density all over. That's including the crown. Okay. If you only do FUE, you may only be able to get around 7,000 grafts in your lifetime. So if you take a donor area that's, let's say, 200 square centimeters and has about 75 grafts per square centimeter that you can extract, and let's say that donor area has 75 follicular units per square centimeter. So your entire donor area has 15,000 follicular units, but with FUE, you can only take about half of that. So that's going to give you around 7,500 grafts if you're only doing FUE. If you do FUT, most patients can get about 2 strips. And a typical strip is going to be about 40 square centimeters. The big difference is with the strip, you get 100% of the grafts from that strip. So with 75 follicular units per square centimeter and 40 square centimeters in a strip, you get about 3,000 grafts per strip. And most patients have enough scalp laxity to do 2 strip procedures, if not 3. So typically you can get at least 6,000 grafts from FUT over your lifetime. A lot of times you can get more if you have a laxity for 3 strips. But that's if you only restrict yourself to one or the other. But if you do both, all those FUT strips, all those grafts that you take from the strips are going to be within that donor area, which is again about 200 square centimeters. So 2 strips, 40 square centimeters each, you get about 80 square centimeters that you're taking from that donor area. So 200 square centimeters minus 80 square centimeters of FUT gives you 120 square centimeters of untouched donor. Now with that untouched donor, you can take about 50% of it with FUE before it starts to look depleted. So if you have 120 square centimeters remaining, 75 follicular units per square centimeter, you have 9,000 grafts left in that donor area, which you can take half of. That's going to give you approximately another 4,500 grafts. So 6,000 grafts from the 2 strips plus 4,500 grafts from the FUE in the remaining donor area give you 10,500 grafts. Now that number could be a little off, okay? It's going to vary depending on your donor area, on your scalp laxity, but most patients should be able to get close to 10,000 grafts just from the scalp by maxing out FUT and FUE. That's the big advantage. If you're a Norwood 6, you need to get about 10,000 grafts to really get a good result. Now, if you're okay with leaving the crown, maybe you don't need to do FUT. Maybe you can just do FUE. 7,500 grafts will still give you a very good result, probably even some decent crown coverage, but probably not the density that you want. The other big advantage of FUT is you're going to get the most DHT resistant hair. So when we expand the donor area, like surgeons do nowadays to do FUE, you're going to the borders of the donor area. It's not always easy to predict where someone's final hair loss pattern is going to be. Even if you're Norwood 6, it's possible that your crown could still expand further over the years, especially if you're not on medication. So it's entirely possible that for surgeons that are taking FUE grafts from the border of the donor area, well, they might misjudge the border and they might take grafts from an area that's going to fit in the future. If that happens, then of course those grafts will be lost even after they're transplanted. With FUT, the grafts that you take are from the most DHT resistant area of your donor. It's very rare to see even in Norwood 7, whose occipital donor area, the area that you're taking the FUT strips from, it's very rare to see that area thin significantly even at an older age, even in advanced hair loss. So FUT is going to give you the most long-term DHT resistant hairs you can possibly get. And if you have significant retrograde alopecia, so if your donor is thinning in this area and in this area, that donor area, that 200 square centimeter donor area that we talked about earlier, that might be a lot smaller. It might be 150 square centimeters. And in that case, you just have a lot less area that you can take FUE grafts from. So FUT is still going to be very viable for most patients and makes a lot more sense in that situation. Finally, if you have really good scalp laxity, if you have a very lax scalp, then you'll be able to take 3, maybe even 4 strips, and you can go from 6,000 grafts from strip to maybe up to 9,000 grafts in some really extreme cases. If you're a Norwood 6, you probably need about 10,000 grafts. This is where I think FUT can really be a game changer. I've had 2 procedures. I'm 1 month post-op from my second. And by using FUT and FUE in both procedures, I've had 9,400 grafts taken from my scalp, no beard hair used. I probably have a decent amount more grafts that I can take with FUE. And beard hair is still an option. So there's some doctors that are really good at using beard hair, like Dr. Felipe Patella. But it's pretty rare that a doctor can move large amounts of beard grafts. And doctors like Patella, they're not cheap and they're in very high demand. So the wait list is really long. So there's a lot of considerations when using beard hair. And of course, beard hair does not grow exactly like the scalp. In many cases, it can look really good, but it does have to be mixed with scalp grafts in most cases to look good. So beard hair is not something we can fully rely on. So I hope this made you reconsider getting FUT. I think FUT is a great strategic move, especially for a Norwood 6 or 7, and especially if you're not taking medication. I think it's something that people should consider more, and I hope it doesn't go away. So that's it for today. Thanks for listening.